For the past 5 or 6 years, the Guardian for Children and Young People has asked the government to close 6 old community residential care units. They house some of the state's most traumatised children, often after everything else has failed. But rather than improving kids' lives, the Guardian and other experts argue there's clear evidence the units are making things worse. And until now, that advice has been largely ignored.
These are very vulnerable children. These are children who, through the early abuse and trauma, have had their developing personality significantly changed. These are children who can't trust.
Because of that abuse and neglect, they all experience and have very challenging behaviours. So many of them have also been through foster care or family-based care before coming into residential care.
For some of the state's most vulnerable children, kids in state care, life can lead them here. It's one of South Australia's CRCs, or Community Residential Care Units.
Residential care can and does work for some young people. If you get the environment right, you get the staff to resident ratio right, the staff and the residents are well supported, it can work.
The problem, according to Pam Simmons, is the state hasn't got that formula right and residential care is failing too many children. There are 8 units spread across Adelaide, and for the past 5 years in her role as the Guardian for Children and Young People, Pam Simmons has called on the government to close down the 6 oldest units. She says despite the best efforts of staff, they are not good places for high needs children because they put too many troubled kids together in an institution.
If the children were living in the residential care units, these larger residential care units, for only a few days, a few weeks, even a few months, I'd be much less concerned. But the reality is that most of the residents are living in them for many months, sometimes years, and sometimes for all of their teenage years.
They are too big and they do not allow children to heal in that environment. They are environments of containment.
So far, the Guardian's calls to close down the CRCs have been ignored by the government that appointed her. She is not the only person, though, worried about CRCs and their effects on children. Clinical psychologist Ivan Raymond was asked for his professional opinion by Ms Simmons. Ivan Raymond has worked extensively with children in care, starting out as a youth worker in a CRC.
We have children who are presenting with all these different behaviours, and they watch each other, they observe each other, and what happens is they learn from each other and get exposed to behaviours which they wouldn't have normally got exposed to.
They make one another worse. Is that
They
it?
do. They do, you know, and it's not uncommon for a child to be introduced to prostitution, sex for favours, substance use, self-harming, seeing that aggression and violence is normal.
By the other residents we're speaking of here.
By the other residents, yeah.
This year, as she hands down her annual report, Pam Simmons has produced a table of charts to reinforce her point. They make sad reading. Evidence of damaged children doing further damage to their peers. Children in CRCs represent a small proportion of the overall number of kids in care, but they make up a disproportionate number of sex abuse notifications. And this chart shows the proportion of CRC kids involved in multiple abuse notifications. The result, Pam Simmons says, either of the actions of other residents or occasionally outsiders.
While the residents there represent only 3% of the total children in state care population, they are 20% of the individual children who are involved in allegations of sexual abuse.
It's just one indicator, she says, of concern. If the big CRC's fundamental failing is their size, then what works best, in the opinion of some experts, is something that looks like this. An ordinary, everyday home with far fewer children than the groups of 10 to 12 that can be found in existing CRCs. It is the model they say other states are moving to.
Well, it needs to look like a home. It needs to have normal bedrooms. It needs to have rooms where children can set up and feel safe.
730's request to film inside a CRC unit was denied. Pam Simmons warned the government a few weeks ago that this year she would make her concerns public. Just a couple of days after the new minister, Grace Portalesi, was appointed, she and the Guardian met. There's now been movement on the 6 community residential care units.
I have committed to undertaking a rolling closure program. Between 2013 and 2016, we'll see a number of facilities closed and replaced with newer facilities, or brand new facilities, that will be accompanied also, importantly, by a different therapeutic model of care as well. That's the other really important element in all of this.
I'm greatly relieved at that decision. She acted promptly on the evidence that I provided and the advice that I provided, so I'm relieved that she has done that.
The Minister says there is the money in her budget for a replacement program, but what she's proposing are units that still house up to 12 children.
Her advice is that 12 is too large and you're going to build new units which have 12 in them. What is the point, no matter how good these new ones are, of building something that the clear advice is not the best?
Because the design of the facilities will make all of the difference. The design of the facilities plus the combination of a new therapeutic model will make all the difference.
The Guardian says she'll keep on advising, and the Minister promises that she'll keep on listening. There's a lot riding on them getting it right.
They're young people who are struggling with their own histories and are really trying to do the best. All of them though, have dreams and ambitions for a positive future. None of them are content with where they are or happy with where they are.